for this one is what is called a medium end ultrasound machine. Broadly, it is small or portable, medium and high end. One is this, what we call a linear probe or a high frequency probe, and one is this one. Can you see this one? This is known as a curvy linear probe. Sometimes the high end machine, simple is that you need to, whichever machine you buy, you need to use the, select the linear probe and go for the venous setting. Can you see venous written there? See, every machine has it, just sometimes they have different name, they have lower limb pain, common femoral pain. How do you locate that is that, see the inguinal fold, gently put your probe there. Okay, now in the groin, which is lateral, which is medial, artery or vein? Where is medial? Vein, V-A-N, vein artery. Now, once you get this section, freeze the skin again, defreeze. Yeah. This is the artery, every day make out a pulsation very well. And now I am releasing the pressure, 1 and 2, correct? Now, which of the two you think is the GSB? So, this is your, everyone understood, they saw the junction, this is the SFG now. And you can see the valve also, thin flimsy valve at the junction. Simple landmark to identify GSB. You palpate the malleolus, medial malleolus, and you start panning your probe like this, you will see the GSB. See. Guarantee you that this, the Doppler report, which I must have done here or wherever, they must have not mentioned. Because as radiologists, when we are trained, we do not know the importance of accessibility. I will take a turn and come on this side. So that beach wala, it was there. So now you know we are sitting on the wall because it may not be able to pump. That skin may be holding it. Second situation, both may have gone inside, but when you try to pull it out, like when you try to pull out that because of the friction. In both the situations, what happened? Instead of being in the vein, your cannula may sit on the wall. So you may get some blood because you technically. The big deal is, remember this: varicose veins are very highly sensitive to spasm. The moment you touch them, they are going to go into a crazy spasm. Now, when we go through and through, both the factors are eliminated. See, if you've gone through and through, while pulling out, even if it comes back, doesn't matter, right? Because we are anyways going to pull it back. And second, it is very in the heaping up here. So you know that your puncture is more. So for that reason, always you need to go through and through. Because if your first attempt is out only, doesn't matter. But you have touched the vein and then the wire doesn't go, the vein will go into spasm. Yeah? So now we need to pull and see. Yeah? Okay, everyone see the sheet tip. You can see that vein, what is happening to the vein when I am injecting in pulses. Saw that? So we have confirmed that we are inside. To do circular structures, everyone appreciate. Time for compression. And how we put the sheath? Make sure the guide wire is back. How do you insert the sheath is that you hold one here and one end here. And see my hand movements. Huh? What am I doing? I am using that dilator now to dilate the fascia. I don't have to take a stab. You can take a stab, but I don't prefer giving. So see, ideally, I hold my hand here, but just for demonstration, I am not holding. See, this is the movement. Can you see my movement? It's not that I am pushing it. This is what I am doing. So simultaneously, I am dilating the skin also for my sheet to go. Or then you can take puncture in the thumb also, and the grade 2 also doesn't matter. Laser fibers are mainly two types. One is what you call a bare fiber, what is what you call a radial fiber. What is the difference is that a bare fiber has a tip which emits heat and radial fiber is like a medu vada. So, considering this factor, which of the two do you think is better suited for varicose ablation? Correct, because you want a complete 360-degree ablation of your eczema. The whole purpose of this is that by chance, if the fiber breaks inside, the one part will come in your hand, right? So you know how much length is broken. That's the only rule of it. Apart from when this marker comes out. Which was this marker? Skin marker. When the skin marker comes out, that is your end point of your ablation. You stop ablation there. So again, bottom line is, the moment you see this, let's assume even if you leave 1 centimeter away, it makes no difference at all. So moment the skin marker comes, that's your end. Got it? Instead of stopping proximal to the SFJ, we fire it in the common femur. Yeah? And why can that happen? By mistake when we fail to identify the tip of the laser. So the next 3 things which I am going to tell you, those things, straight segment, after that bend is over, and put your fiber here. So you ablate this segment, and the middle part injects sclerosing. It's called a sandwich technique because you're ablating the two ends and putting your center. See, acoustic shadow is very self-explanatory. I'm sure everyone can see that, the white like a waterfall. And can you see like a step here, which I think the image has got moved. Just unfreeze the screen. I'll show you the step also nicely. Unfreeze the screen. Yeah, better step. And white bar, everyone can appreciate the acoustic shadow. Step, now here the thing is the diameter is not, normal fibers they have a little bigger difference. So the step is more visible. Here the step is a little small, so you may not be able to see that well. Confident you can go up to 6-7 centimeters also, doesn't matter. Theoretically they say if you go more than 5 centimeters there is risk of saphenous varix formation. In so many years I had one patient who had saphenous varix. And like we all know, there is no way we should take the blame for that. I mean, this is bad luck. What do we do? So, see what is it doing? It is compressing also the vein. See, it is compressing also, and at the same time creating a fluid barrier around. To bupivacaine toxicity, I never knew such a thing existed in my life, but they said it is. So that's why it is. See here, what is happening? Where is the fluid going? Both sides. See. See, like I said, all these points are very important to remember because these are something which practically are going to cause problems.
500 ml.
We need more for the left leg.